Hello, my name is Kushagra Verma, and I'm a spine surgeon in Los Angeles, California. I'm here to talk to you about scoliosis and the recovery after adult deformity surgery. So patients often ask what the hospital stay is like after surgery. Typically, it can be extensive, and there's a prolonged period of recovery and convalescence. Patients are typically in the hospital for 4 to 7 days after surgery. During this time, the physicians and the physical therapists and the care team work pretty hard to get you back to the activities of daily living, getting out of bed, going to the bathroom, working with physical therapy to make sure it's safe for you to get home. In addition, during this time, we make sure your pain is well controlled, you're having no issues with your wound or things like that. After 4 to 7 days, the case managers and physical therapists usually work to figure out if it's safe for you to go home or it's safe for you to go to another specialized care facility. Will you be able to wear high heels after surgery? Patients often ask us this question. Shoe wear is a difficult topic. Typically, if you've had a fusion of more than 4 levels, or if your fusion extends to the pelvis, wearing high heels could be difficult, especially at first. Typically, surgeons recommend that you get through the recovery period and walk with normal shoes. And then as your recovery progresses and you feel more comfortable, you can begin to wear high heels. Typically, patients after a larger fusion surgery won't drive for the first 4 to 6 weeks. They have to get through the recovery period, and typically patients are on opiate pain medicines that limit your ability to drive. Typically after 4 to 6 weeks, surgeons are comfortable with you resuming driving once you're off of the pain medicine. As far as returning to work, this varies depending on the patient and the type of work and the type of surgery that's done. Most patients will be out of work for 4 to 6 weeks after a large fusion surgery, and then may go back to work with light-duty restrictions for the first 6 weeks after that. At around 3 months, the lifting restrictions are lifted and patients can lift up to 25 pounds. After 3 months, patients are also able to dictate the amount of work they're able to do based off their individual recovery. When can you resume a normal workout routine? Again, this varies based off the patient and the type of workout that you do. Most surgeons would recommend primarily walking in the first 4 to 6 weeks after surgery. There are no restrictions on walking, and most surgeons encourage you to walk as much as you can every day. More strenuous exercises are usually reserved for after 4 to 6 weeks after surgery and usually initiated with some physical therapy. After 3 months, there's usually no restrictions on strenuous activity, and patients can regain activities that involve heavy lifting, and they can also resume activities that would require strenuous cardio exercise. The answer is no. Most of the time you won't set off the metal detectors, and most metal detectors aren't sensitive enough to pick up implanted hardware. However, in certain circumstances we have heard of this happening, and patients sometimes bring a photograph of their x-rays to show the airport personnel. Alternatively, you can show the airport personnel your incision, but we haven't had this be a major problem for patients when traveling.